Hey everyone, have you noticed how some of us love to play doctor, especially when it comes to mental health? Oh, that person is so energetic, they must have ADHD. Sound familiar? We hear it all the time, but being energetic and having ADHD are two very different things. Let's talk about what ADHD, or Attention Deficit Hyperactivity Disorder, actually is, based on the official diagnostic criteria. First, a diagnosis requires a persistent pattern of inattention and/or hyperactivity impulsivity. That's way more disruptive than what you'd expect for someone's age. For kids, this means showing 6 or more specific symptoms for at least 6 months. For teens and adults, it's 5 or more. Let's break down the inattention part. This isn't just about being a little spacey. We're talking about consistently making careless mistakes, having serious trouble staying focused on tasks, not seeming to listen when spoken to directly, and struggling to follow instructions. It could also mean being disorganized, avoiding mentally demanding tasks, constantly losing important things like keys or phones, being easily distracted, and being forgetful in daily life. Then there's the hyperactivity and impulsivity side. Again, this is more than just having a lot of energy. It includes constantly fidgeting, being unable to stay seated when you're supposed to, or feeling extremely restless inside. It might look like being unable to do quiet activities, always being on the go as if driven by a motor, talking excessively, or blurting out answers before a question is even finished. It can also involve having a hard time waiting your turn and frequently interrupting others. But that's not all. For a real diagnosis, several of these symptoms must have been present before the age of 12. They also need to show up in at least 2 different settings, like at home and at school or work. This shows it's a consistent pattern, not just a reaction to one environment. Most importantly, there must be clear evidence that these symptoms are getting in the way of a person's life, socially, academically, or at work, and a professional has to rule out any other mental health conditions that could be causing these symptoms. As you can see, ADHD is complex. It's not just a label for being energetic. There are even different types: predominantly inattentive, predominantly hyperactive impulsive, or a combined presentation. Only a trained healthcare professional, like a psychiatrist or a psychologist, can make an accurate diagnosis after a comprehensive evaluation. So, the next time we're tempted to casually label someone, let's remember this. Let's encourage understanding and support, not armchair diagnosis. If you or someone you know is genuinely struggling with these symptoms, the best step is always to seek professional help. Thank you for watching, and I hope this helps clear things up. Again, this is Dr. Eric Jake C. Lim. Don't forget to like and subscribe for more content like this.